Good morning. My name is Arjan Haverhals and I'm the president of Milestone Scientific. Today we have a major announcement to make. We have been awarded a group purchasing organization with Premier. Premier is a leading healthcare improvement company. They have access of 4,100 hospitals in addition to 200,000 providers to transform healthcare. We are very honored and pleased that we have been awarded this agreement, as it will increase our accessibility to the Premier members. The Premier members can benefit from pre-negotiated terms and conditions through their network. It is an important step for us, for our company, moving forward. Apart from the increased accessibility, we also believe that it will enhance, and it should help, enhancing our mission to become the standard of care in the epidural market. We also believe, and management believes, that this initial first agreement with Premier would potentially open up other opportunities to reach similar agreements with other group purchasing organizations. Let me explain to you why we ended the epidural market segment. Milestone Scientific is a medical research and development company that designs and patents injection technology applications. We have used these patents successfully in the dental market, and logically we entered also the medical market segment. The epidural market is, like I said, has a value of $5 billion. About 11 million procedures are performed in the US alone, whereas this number is 30 million procedures worldwide. 2.4 million women in the United States will have an epidural analgesia during labor and delivery out of 4 million births. This means that 1.6 million women do not have these epidural injections, as it is associated with these risk factors. In the literature, morbidity rates are reported of 4.5 to 5%. These risk factors include migraine, severe migraine for up to 6 weeks, transient paralysis, permanent paralysis, mortality, although these cases are seldomly and rarely to be reported. The second reason why we entered the epidural market is that we believe that we can contribute to lower the cost of training and education. Training and education today is performed for epidural anesthesia with the residents. In a study performed by Gebhardt et al., we know that it takes up to about 90 procedures, equivalent to almost 2 years, to have the confidence and to reach the confidence to perform these epidural procedures. In that similar study, when residents performed the injections on the robot model, we were able to reduce these 90 procedures, or the 2 years, into 2 procedures or 2 days. So by having this result, we are able to reduce the cost of training. Then thirdly, cost of litigation. We believe that the cost of litigation is the equivalent of $300,000 or more. So the standard of care today is what we call the loss of resistance technique, or the loss of pressure technique. And it's not more or less than using a hypodermic syringe. The hypodermic syringe, upon entering the epidural space, is then filled with saline, and then the pressure is registered at the thumb of the clinician by pushing the plunger. If there is a loss of pressure, then the clinician believes that he is in the epidural space. Now, performing this procedure, there are some elements that I would like to explain. Prior to entering the epidural space, there is fatty tissue, or there's low density tissue that also would result in a loss of pressure. But that is what we call a false positive result. 17% of the epidural injections performed are associated with these false positive results. That means that the drug cannot be delivered to the patients at the right site. Our technology is using the dynamic pressure sensor technology. This means that constantly in real time, pressure changes are going to be measured at the tip of the needle. So each tissue has their own pressure characterization or pressure signature. And by measuring the pressure and the real loss of pressure and loss of resistance, we are able to know and to get the confirmation that the needle is actually in the right place in the epidural space. There's another effect which is more dangerous, and that would occur when the needle is being entered too far. It will breach the membrane and then it will enter the spinal canal. As a result of that, there will be leakage of cerebrospinal fluid, which will then cause the side effects and which will then result in the morbidity. So with our system, what we call the Compliflow epidural system, we are able to know exactly, based on the drop of pressure registration, that we are in the epidural space, and thereby potentially then can avoid the morbidity and the side effects. This concept has been published in 9 peer-reviewed clinical trials. So not only the right placement and the right position of the needles, which shows an efficiency rate of 99%, as well as the training of the residents, like I mentioned earlier, the study of Gebhard et al. And in addition, we have done a study looking at the cost benefit of our system. In a study performed by Dr. Rovnat Babazadeh, it has been concluded that on average there is a cost saving of $504 per patient. Assuming that in his hospital, where they perform 12,000 epidurals a year, this $504 per patient would then result in a cost saving of $6 million for the hospital per year. The same technology has also been used in our cath check. Let me explain what cath check is. After giving birth, the patient will stay and will move to the operating room. So what happens actually is that the catheter remains in place and it will be in a way taped on the back to the patient. But during transportation back to the room, there is a risk that the catheter is out of place. What we call the catheter is dislodged. What the clinician is doing then, because the patient is still in pain, and this happens up to 40% after labor and delivery procedures where the patient remains in pain, what the clinician is doing then is giving a so-called bolus injection. He injects the anesthesia and then has to wait for 40 minutes until he will be able to see the result, whether there is anesthesia or not. If we would connect our consumables and our tubing to the catheter and measure again the pressure and the positioning of the catheter, actually what we're doing, we measure an heart rate, because it is known that in the epidural space there is a cardiac pulse rate. So by measuring this cardiac pulse rate, we immediately know within 2 minutes whether the catheter is still in place, and thus the injection of the analgesia can be performed. So we were able to reduce the 30 to 40 minutes up to, or reduce that to 2 minutes. So that has been, an importance for the patient and for the efficiency, and also for time saving, as clinicians can reduce the number of interventions after catheter placement. So in summary, with our technology, with the recent award of becoming a partner of Premier, we, management, believe that we have all means the clinical publications, the clinical experiences, the clinical results, the efficacy and efficiency, the cost saving in terms of education and litigation cost, as well as the partnership with Premier will help us and should help us in accelerating our mission to become the standard of care. Thank you very much.